Good afternoon, everyone. I wanted to say thank you for coming. We're going to go ahead and get started. It's 12 noon. I'm sure we'll have some additional people popping in as we get going here. But again, I'd like to thank you for attending this webinar today. And welcome to Stanford's Nurse Residency Program Interview Preparation Webinar. My name is Christy Norris, and I am a Nursing Professional Development Specialist with the Center for Education and Professional Development here at Stanford, and I support the Nurse Residency Program. Before I begin, I want to note that this webinar is being recorded, and we will also have a Q&A session following this presentation. So I'm going to ask that you hold your questions until then. My hope is that I will have answered the majority of your questions by that time, and we will have a chance to also meet some panelists, which I will introduce shortly. So before we start, though, I would like to go over our objectives for today. So by the end of this program, our goal is that you will understand the Stanford Healthcare Nurse Residency Program interview structure. You'll understand the key features of behavioral interviewing, articulate strategies for to successfully prepare for behavioral interviewing, and understand the goals, structure, and curriculum of the nurse residency program. So first, I would like to introduce our team. So here, joining me today is Leticia Cortez and Carrie Zoss. They will be working behind the scenes, answering the chat and supporting me through the webinar. I also want to introduce Carly Dye, who is not with us today, but she is our HR partner and senior talent strategist supporting the nurse residency program. Next, I would like to introduce our panelists today, and I will have them introduce themselves a little later on, but I'm excited to share that we have 3 of our nurse residents joining us today. They will be able to share their experience in the interview process, as well as in the nurse resident program, and then they'll be able to answer some of the questions that you might have. All right, sorry, wasn't advancing. So before I get into preparing for the interview itself, I want to discuss the nurse residency program interview structure. After the application is screened and scored, depending on your score, you may be invited to a panel level interview. So we utilize a tiered approach to our interviews. And the first tier is really a virtual panel level interview. And then should a hiring manager want to bring you back in, you will move to the second tier, which is a unit or department level interview. You will interview based on your first, second, or third specialty preference that you selected on your application. If you selected medicine as a preference, for example, and you are interviewing for the medicine units, then the hiring managers for those units will be present on your panel interview. If you are interviewing for the critical care region, then the hiring managers for the critical care region will be present on your panel interview, and so forth. There will be 5 candidates in total on your panel interview. In addition to the candidates, there will be also a facilitator, and then as previously mentioned, the hiring managers for the department that you're interviewing for. The questions themselves will be behavioral style questions. We'll discuss what this means in a little bit in terms of what that looks like and how to prepare. We know that you will have a lot of questions for the hiring managers, but due to the number of candidates and the multiple panel interviews that we will be conducting, we're going to ask that you hold those questions, and then should you be asked back for a unit level or department interview, it's there that you'll be given the opportunity to ask those questions. As the interview concludes, you will be given instructions on the process following your panel interviews so that you are aware of the next steps. Following the panel interviews, the hiring managers will come together, they'll discuss all the candidates they've interviewed, and again, should a hiring manager feel that you would be a good fit for their unit or department, they will reach out to you by phone and offer you a unit level interview. These interviews are primarily virtual. However, if you are a local, or if you are currently employed as a Stanford employee, the hiring manager may ask you in person to meet. So these interviews could start as early as June 21st. In the unit or department level interview, the hiring manager will be present along with other members of the leadership team, including the assistant patient care managers, possibly the unit educator, the CNS, and maybe an individual on the clinical staff. This is left to the discretion of the hiring team. This will also be behavioral style interview, which as well will have an opportunity to maybe ask some follow-up questions or additional questions around your clinicals, preceptorships, your strengths, your weaknesses, professional background, etc. At the end of this interview, you will have a chance to then ask the questions that you have. So that's when you'll save them for that aspect. Final HR offers go out on June 30th. So you will be hearing from them possibly that afternoon, maybe before that, and possibly depending on the timing, it could even be the early part of that following week. So this concludes really the logistical part of the interview process. So let's talk a little bit more now about the panel level interview process. So you will be provided a Zoom link for the specific time and date that you were scheduled for. My suggestion is that you log in about 5 minutes beforehand, and then you will be placed into a waiting room. Once you are brought in out of the waiting room and into the interview, you will be given some instructions, and the hiring teams on the panel will introduce themselves. The interview will begin with each candidate interviewing themselves, where you went to school, relevant work experience, volunteer experience, or other pertinent information. This is really your opportunity to connect and share. This will be your first impression. So it will be important that you are organized with your thoughts and what you want to share. It's important to be concise and try to keep it to around 2 minutes in length. So practice ahead of time so your very best self shines at this moment. We're going to discuss how to prepare later on for this, so there'll be a few more tips and tricks for this. The interview questions are asked in a rotational sequence. So each candidate will have the opportunity to be the first to hear and respond to a question for the first time. Again, these are all behavioral style questions, and each candidate will be asked 5 questions in total. Each candidate has been asked all the questions, or after each candidate has been asked all the questions in the interview, this will conclude and next steps will be provided. So each panel is about 1 hour in length, and hopefully that answers most of your questions. But again, if there are additional questions that you have regarding the panel interview process, at the end of this presentation, you will have an opportunity to ask those. So now I'd like to share some strategies for behavioral interviewing. You may not be familiar with it, and that's okay. We're going to spend some time discussing it. So if you are not familiar with the term behavioral interview, as I stated before, that's okay. Behavioral questioning is really focused on the candidate's past experiences. So you're going to hear questions that are phrased in a certain manner. You're going to hear, tell me about a time when, or give me an example from your previous experience. We utilize this style of interviewing because by asking candidates to provide specific examples on how they have demonstrated certain behavior, knowledge, skills, or abilities in the past, those will serve as the best predictor to determine how a candidate would respond given a similar situation in the future. So, an example, if you were to share an example around communication that took place during your capstone, that would tell us how you would likely respond in a similar situation in the future. The questions we'll be asking, what did you do, not what would you do? Answers to behavioral interview questions should provide concrete evidence as to how the candidate has dealt with issues in the past. Again, this information serves as the best predictor to determine how a candidate will respond given a similar situation in the future. You may be prompted with a question and feel that you haven't had that experience. We don't recommend that you answer, I haven't had that experience. Instead, we want you just to pause for a moment and think, and then respond with the best you can answer for a similar situation or scenario. As we go further in the webinar, we're going to go over some situations I think that'll help you navigate and prepare. The interviewing style allows us to really access the critical areas of the job requirement, as well as those that are critical to the broader culture of our organization. What does that mean? Not all questions are going to focus on clinical scenarios. We're looking for traits of a clinical nurse, how you use those tools and provide care. In the panel interview, you are not going to get questions on how you have responded to a patient having a MI or tell us the pathophysiology of the heart. Instead, we want to hear how you put everything together and provide safe, compassionate care to your patients. Behavioral interviewing has a structured interview style. Not everyone has the same experiences, locations of clinicals, and preceptorships. And so utilizing this style of interviewing questions really allows the candidates to still participate and answer the questions despite everyone's unique experiences. This allows us to then objectively match the candidate based on their skill set. So where do I start? How do I prepare? Well, we have some strategies for you. You're going to want to spend some time preparing, and this webinar is going to help you with that. Next is practice, and you're going to need to do that also. And lastly, you need to perform. It's showtime. So before we go into the next slide, I want you to take a minute and brainstorm a little bit in your head. Think of all the qualities of a nurse. Think back to your preceptorship, your clinicals, volunteer experiences, life experience. What makes a great nurse? Is it being a really good critical thinker? Is it the ability to advocate? What are the qualities that you have observed and admired? Is it integrity? Maybe compassion? Thinking out loud? Start thinking of examples, because having this list is what's going to help you prepare for your interview. So to prepare, the first step is you want to brainstorm. We were just chatting about this. Think about all the qualities that make up a great clinical nurse. There are a lot, and these are just a few examples. Think about your experiences that you have had. Again, clinicals, in school, during your preceptorships, volunteer, in which you demonstrated those qualities. Start putting the qualities together in buckets. So maybe you have a bucket that's education, advocacy, and communication. And then think about examples where you have exhibited those behaviors and those qualities. Maybe you want to talk about, a patient experience or a family member, when you had to provide or receive feedback. Think about all of these qualities and how you put them together and put those into buckets based on your scenarios. Ask yourself some questions so you can begin the process of categorizing your own experiences. So now that you have some of these experiences and qualities grouped together, what happened? What part did you play? What did you demonstrate? How did you demonstrate the qualities that are important to you? And then what was the outcome? What's important to note is that your story is not going to be scored. However, how you responded will be. So let's walk through an example where you're being asked a question regarding feedback. So you were provided feedback that you needed to improve your time management. Your preceptor stated that you have been significantly behind and disorganized during your shift, which has created delays in patient care. You took that feedback and made a more conscious effort to write some more things down on your brain sheet. And at the end of your shift, your preceptor gave you some feedback that your time management had improved. So now let's compare a second example. And in this one, I'm going to use the qualities of time management, feedback, and communication. So same story. You were provided feedback that you needed to improve your time management. Your preceptor stated that you've been significantly behind and disorganized during your shift, which has created delays in patient care. You took the feedback, asked some follow-up questions, and after some reflection, decided to institute a couple of changes. You reorganized your paper, added some information to your brain sheets and specific boxes, and that were very pertinent to the unit you were on. And then went back directly to your preceptor and asked for feedback again. With some additional necessary changes, you began to utilize your new paper brain sheet for the shift and sought out feedback. Your preceptor stated that your time management drastically improved and you were much more organized and had taken care in the care that you delivered to your patients was timely. To take it a step further, you then shared an update on your brain with your clinical instructor, who now shares with students who are struggling with organization and time management. So you can see how those two stories are very similar, but the outcome was different. So your story is your story, and we're looking to see how you responded to that situation. Don't feel like you have to come with this amazing over-the-top story. It's not about that. It's about how you responded. Think about the qualities and the traits that make up a great clinical nurse. What's your story? What happened? What did you do? What was your role? How did you demonstrate these qualities? And what was the outcome? How does this set you apart from everybody else? So the goal is really to get to know more about you. You want to shine. You want to be the center of your story, not a story where my preceptor and I, or my clinical instructor and I, what did you do? Again, we're not scoring this story, but we are looking to see how you responded. So practicing. When you have scenarios, jot them down and review them. Put like categories together. So maybe communication, delegation, and education will go in one bucket. And then cultural diversity and competency and teamwork will go in another bucket. Compassion, caring, advocacy. Those are all just examples. You can make up your own buckets. Think what themes are evident in the scenarios that you are choosing. When you're thinking about your stories, think about those qualities and what are evident and put those together. So that way, if a question comes up, let's say, and you're asked about delegation or prioritization or a caring moment, you have something prepared and don't have to come up with something on the spot. Once you're comfortable with your scenarios, you can start to practice. Review your scenarios till you feel comfortable sharing them. So a good way would be to put a question in a cup or a hat and then pull them out randomly and practice out loud. Get in front of the mirror and record yourself. It's important that you speak out loud so you can actually hear yourself. I know it's sometimes a little uncomfortable and it might feel a little awkward, but it's actually worth it. That way you are as polished as possible for the interview. It will allow you to have a better understanding of how someone else will perceive you. You'll be able to hear all the ums. We always through things sometimes when we're not feeling confident or we're unsure. You'll be able to hear your speed, your pitch, your energy, whether you're smiling or not. You might start to ramble and get off topic. Maybe you will want to adjust how you're communicating the message based on what you hear. Take the opportunity when you're driving, when you're waiting to pick up something, when you're getting ready in the morning, to practice. The more you practice, the more comfortable you will feel, and the more you will be able to connect with your audience. The more you'll be able to focus on what is being asked of you, because you will feel prepared and you will have just a little less anxiety that day. So to recap, we've discussed the panel interviews and the process for them. We've discussed the interview structure, and we've just finished talking about behavioral interviewing preparation and practice. So let's walk through some examples now. Okay, so tell us about a time when you needed to escalate a situation or concern quickly and efficiently. What was the situation? What actions did you take to escalate this care? And what was the outcome? You can see here that we put these qualities in a bucket: escalation, communication, delegation, and resource management. So notice that for each of these, we're going to put these qualities together, okay? Tell us about a time when you needed to delegate a task to a member of your team. What was the situation? How did you communicate your needs to the colleagues? And what was the outcome? Again, we're putting together these qualities of communication, delegation, resource management, and teamwork. So you might also be noticing a theme here. It's what happened, what was the situation, what did you do, or what was your response, and what was the outcome? If you align your qualities and scenarios and frame your answer in this manner, then even if you forget part of the question, you will likely have answered it. Let's talk about the last one here. So tell us about a time when your patient's plan of care suddenly changed. What was the situation? What did you do to respond to the change? And what was the outcome? So remember that This is about your response to these situations. So don't worry about having this amazing story. Your stories are your stories. It could simply be something that the patient had a lot of pain and now you had to, respond to the situation, and now the outcome is they don't have any more pain. There'll probably be more to the story than that. It's very simple. Maybe the patient's going home for the day and that's what their plan. They weren't supposed to, and now they are. And now you have to, again, respond to the situation. And how did you provide a safe discharge? That was maybe not so planned. So think about what those scenarios look like for you and how the traits align in your scenarios. So let's take this time to walk through another example. So the situation is, and this will be one around this last question around changing a patient's plan of care suddenly changed. So the situation is you're caring for a patient who is going home tomorrow. The provider team has decided to discharge the patient today. Now you have cared for this patient for the last couple days, so you know the patient's wife doesn't drive and they live a couple hours away. You also know the patient will be discharged with prescriptions that will need to be filled at the pharmacy and are concerned, given the current time of day, that there will be enough time to get them home and get the prescription filled before the pharmacy closes. You shared this with both the provider team and the charge nurse. You prioritized this patient and delegated some tasks to the float nurse so that you could focus on ensuring a safe discharge. You then communicated with the case manager and the social worker using an SBAR format to assist with facilitating transport and having the prescription filled so that everyone was aligned. You identified that the prescription had not yet arrived when transport did, so you escalated again to the social work, who followed up with pharmacy and had the prescription brought up in time before the patient left. You were able to safely discharge this patient from the hospital with these prescriptions. So in this example, you were able to show how you responded to the situation where a patient's plan of care changed. You demonstrated prioritization, delegation, resource utilization, and escalation. And again, we aren't judging that story, but we're looking to see how you responded to the situation. Let's look over a few more here. So describe a time when a patient, family member, or colleague's view was different than your own. So think about, what this might look like. Again, what was the situation? How did you respond? What was the outcome? You're lumping together that cultural competency, diversity, communication, relationship building, whatever those qualities are, think about what that is. We often hear about sometimes maybe there was an issue around blood products as a religious preference. So think about an example around that. You might also think about an example outside of that. Again, what sets you apart from everyone else? Tell us about a time when you received constructive feedback from a member of your team. What was the feedback? How did you respond? How has the feedback shaped your current nursing practice? So again, this is about communication, that growth mindset, and teamwork. And so when you think about that, focus on, again, what was your response? Because feedback is okay. It's not a negative thing. So think about what was your response to that. And then lastly, we have, tell us about a time when you advocated for a patient, family member, or colleague. What was the situation? How did you respond to the situation? And what was the outcome? So here we're lumping together teamwork, relationship building, compassion and caring, and then resource utilization. So we've spent some time talking about how to prepare and now how to practice. Let's go ahead and start talking about now how you perform. So as I said before, it's showtime. And so you really have to plan accordingly for this. On this day, there is a chance that you might be a little nervous. So planning ahead is going to go a long way and really help you out. So what we suggest, position yourself in a quiet, comfortable space and limit distractions as much as possible. So sometimes those are out of your control, but if you know that you have, a dog that has a thing for the mailman, or if your cat loves to just walk across the screen as soon as you put your computer up, this is going to be the time where you, again, position yourself in a room where maybe they don't have access to you, or maybe you position them in a room where they don't have access to you. So do a Zoom test run. Check the lighting, make sure we can see you, make sure that your audio works. Sometimes we notice that it's very dark and we can't see the candidate, or the candidate's camera is down like in their lap or somewhere, and now we're looking up at them as opposed to at them. So think about all those things when you're doing your test run. Make sure you can hear yourself. If you're using earphones, you want to make sure that the audio works well. You're not going to be double muted or have to worry about the stress around navigating that piece if you're not comfortable with it. If you know you have unreliable internet, figure out a solution ahead of time for that. So that means you might have to go somewhere else or have some other type of solution to do that, because if we can't hear you and you're not able to participate in the interview, there's not much we can do with that. We've talked about animals. Ensure that you have a device that's charged. Turn off your notifications. You might even think to choose a professional background. Wear professional attire. Listen carefully to each question. And if you didn't quite catch it all, if you're not sure what they're asking, ask the question to be repeated. That is okay. And if you're nervous, just remember this is a conversation. We're trying to get to know you. Take a deep breath. Interact with the panel, show them your personality. It's okay to smile, it's okay to nod your head, it's okay to, even if someone shares a story and it happens to be something that's kind of funny, it's okay to actually, have a light laugh. Nothing too over the top there, but it's okay to have a light laugh. The more you practice and prepare, the more you're going to feel confident and capable. And so despite everything we're sharing with you, we can't teach you how to be you. So that's where you have to come in, help yourself, and prepare and practice and perform. So let's talk about during the interview itself. So you're going to want to listen carefully, and you're going to want to listen fully to each and every question and ask for clarification if you need it. Don't answer a question until you understand what's being asked. Don't overcomplicate the question. Take a breath and relax if you need to before you answer or once they share the question with you. Don't feel like you have to rush your answer, but be mindful of what is being asked so you stay on topic. So the questions will have multiple components, so listen to them carefully. We've kind of talked about what that's going to look like. Write down the question if it's needed, or maybe you're just writing down, if you hear the word escalation or prioritization, maybe that's all you're writing down. So that is your one point that you know that you need to hit. None of the questions are going to be trick questions. They're going to be very simple and straightforward. As we said before, if you don't know the answer to a question or you don't feel like you have an example, we highly recommend that you don't say, I don't have a situation where this has occurred. Instead, we want to really encourage you to pause for a moment and think about a situation that could be applicable or a scenario that could be applicable. So we want you to use examples from your clinical rotations, your internships, your externships, your voluntary experiences to really showcase you when answering these questions. We want you to be mindful of the role that you are interviewing for, and that's of the clinical nurse. If you're using an example from your previous life or personal life, or maybe as a nursing assistant or another role that you might possibly be in, then the hiring managers may only be able to see you in that light and not in the light of a clinical nurse. And that's the role that you are applying for. So we want you to bring your best self, limit those distractions, connect with your hiring managers. Don't be swayed by someone else's response. Be authentic to your story. You will be able to speak much easier to that than trying to change things up at the last moment. This is not a competition with someone else. And finally, just breathe. I know I've already said it, but at the end of the day, we're just trying to get to know you and have a better sense of who you are and how you've responded to certain circumstances in the past. So a few last tips and tricks. So we talked about being your true self, okay? That's number one. Connect, nod, smile, If there's something again to laugh at, it's okay to give a gentle laugh about it, okay? Don't fall out of your seat. Just give a gentle laugh to acknowledge that it was funny what they shared. Do not allow the answers of others to diminish your own. Be proud of your story because it's yours, and don't be discouraged or don't feel like you didn't get certain experiences, so you're not good enough. Remember, it's how you responded to these situations and it's how you made the most of it. So just celebrate your own story. You have a lot to be proud of. So I'd like to now go over the nurse residency program itself, just briefly, and then we'll have some time to go over some Q&A, introduce our panelists to you, and go from there. So who are we? The Stanford Healthcare Nurse Residency Program is a nationally accredited transition to practice program through the American Nurses Credentialing Center, ANCC. The ANCC sets the standard for residency programs and transition registered nurses into new practice settings. Our comprehensive one-year program includes 300 plus hours of clinical orientation with a dedicated preceptor and supplemental education of newly graduated clinical nurses. Our program is very thoughtfully designed for highly motivated, determined, and compassionate nurse grad residents. The overarching goal is to develop compassionate and competent and committed clinical nurses who make a positive impact in the lives of our patients. So how do we do this? Part of reaching our goal to develop these competent, compassionate, and committed clinical nurses is with our curriculum. And we use Vizient's Nurse Residency Program curriculum. Vizient's Nurse Residency curriculum was developed by Vizient, who partners with academic medical centers and the American Association for College of Nursing. It was developed during a time of need when many new many new nurses were leaving their role within the first year of their career. The residency program's curriculum was created with a goal in mind to support new graduate nurses in their transition to practice. Our program isn't an extension of nursing school, meaning we don't reteach nursing. We take all of your clinical backgrounds, skills, and experiences, and then we build on them. We teach you how to apply all of this in the clinical setting. So the program integrates 3 principal domains, and I'll touch on each of them briefly. So the first is leadership. And here we discuss the use of effective decision-making skills. We discuss techniques regarding communication, giving and receiving feedback, escalation, delegation. All of those are examples. We also focus on patient outcomes. So how do we incorporate research-based evidence into our practice? We look at managing the patient whose condition is changing. How do you integrate the patient and family in need of teaching? How do you incorporate infection prevention strategies? And lastly, we talk about professional role. And this is where we spend time strengthening the candidate's professional commitment to nursing. We assist with formulating an individual professional development plan. What does the future hold for you? Where do you see yourself in the next 2 to 5 years? How do we expose you to information so that you can put yourself on the right path to achieve your goals? We also spend a lot of time emphasizing self-care and stress management. This looks different for each person. And so it makes sense that we take time to really help the resident identify tactics and strategies that will work specifically for them so they have tools to care for themselves, especially during this first year. So this is a list of the hiring units and departments for cohort 39. Our goal is always to hire 100 nurse residents. However, that number fluctuates based on the hiring needs of the organization. So you also might be wondering what AAU stands for. AAU stands for Acuity Adaptable Unit. So in other hospitals, you will hear the term med-surg or you will hear the term intermediate care. Stanford is a specialty hospital. So the specialties are broken down into the critical care, oncology, surgical, and medical regions. So for example, in our surgical AAUs specialty, we have cardiac surgery, hepatobiliary, trauma. Those are just a few. And then for medicine, we have neurology, pulmonary hypertension. Again, those are just a couple. What sets Stanford apart from other hospitals is really our ability to adapt to the patient's need. So when outside of the critical care units, the AAUs can provide care to patients from acute care to intermediate care. So, as an example, if an acute care patient requires more frequent intervention or monitoring or telemetry, then the patient then can become an IIC level patient and can stay on the specialty unit which they have been on, where they are with practitioners and clinicians that understand the reason for their admission, their surgery, who we've already built a relationship with, and still receive the care that they require without having to transfer to a different department. So the nurse's assignments can flex and stay within ratio to accommodate the now IIC patient. Float pool. Float pool serves the surgical, medical, and oncology AAUs. This is also where all the training takes place. So depending on the needs of the organization, on any given day, the nurse would float to the area in need. And then lastly, clinical trials. You may also be wondering, what's clinical trial and what do they do? So clinical trials is a direct patient care facing position. A nurse in clinical trials department cares for admitted patients undergoing clinical trials in all specialty areas, not conducting research. So an example, a patient is admitted under trauma, but they are taking a test drug that is part of a clinical trial. Then a clinical trial nurse will go and take care of the patient on that unit. It's important that the clinical trials trained nurse cares for this patient in this particular trial because there are a lot of details and guidelines important to the validity of the study they are part of. It's important that for this population that the nurse really has that specialty training with these studies. They can provide care for the patient and maintain the integrity of the study at the same time. During times when there's not a clinical trial going on, then the department works collaboratively with float pool and supports staffing in the inpatient medicine, surgery, and oncology units. So let's walk through this timeline right now for cohort 39. So based on our current organization's needs, we are aiming to take approximately 89 residents into the cohort. Some important dates I want to share with you. So at this point in the application process, we are working on interview panel preparation. This takes us a few weeks to get everyone organized into the appropriate panels. Beginning June 19th, we start the panel interviews. So should a hiring manager feel that the candidate would be a good fit for their unit, they will invite the candidate back for a unit level interview. And these invites could start as early as June 21st. HR will have final offers to candidates by June 30th. So I also want to call attention to the cutoff date for the California RN license. That's July 31st. You will need to have your license by this time so that we can perform all necessary pre-employment clearance in time for the cohort start date of August 21st. So I hope you have found the information shared today helpful and that I was able to answer many of your questions. We understand that you might have a few additional questions today, so I want to provide you the opportunity to ask our residents your questions related to the interview process. So I am going to ask them to introduce themselves one at a time, and then we'll allow for some question and answering to happen. So I will start with Betty. Betty, could you introduce yourself? Tell us your background as a student, what school you went to, and then what unit you're on now.
Sure. Hi, my name is Betty. I went to San Jose State. I graduated exactly a year ago, and I'm currently in the oncology AAU on F3, and I started the program this past August, so 10 months ago now.
Thanks, Betty. All right, Den, could you introduce yourself now?
Yeah, my pleasure. Hello, everyone. My name is Den. I graduated from SF State. I did an accelerated master's program. It was nursing is my second career. I graduated December of 21. Currently, I'm on Unit L5, which is stroke, epilepsy, and neurology.
Thanks, Den. And Jaden, last but not least.
Hey, everyone. My name is Jaden. I went to nursing school at University of Miami. And currently I work on eGround, which is the blood and marrow transplant unit.
Thanks, Jaden. Okay, so I'm going to stop sharing and I'm going to give everybody an opportunity to now ask our residents some questions regarding their interview process, maybe how they prepared. Any questions for our residents? You can put up your virtual hand. That's easy. All right, Riley, I see you have a question.
Yes, I was just curious for the candidates. So I personally have never done a panel interview with other candidates in the interview while I'm interviewing. How did you guys go about preparing for that aspect of the interview?
Good question. Betty, do you want to start?
Sure. That was also my first time. I had no idea what that would look. I thought it would be extremely intimidating, but it really wasn't that bad. The kind of amazing thing for me, it's like you kind of compare yourself to other people. You can't help it, but everyone else on the panel was just like really, really great. So the only thing that I can really like say to you to prepare is like not to let you intimidate that or to be intimidated by that, because you have your own story, you have your own things to say. So listen to what the other candidates say, because it's just interesting and you're already there listening, but don't let that intimidate you. You're going to have your couple minutes to shine, tell your story, just stay calm. And it was actually really interesting also to see those candidates later like get into the program and recognize those faces. So that was always kind of like a cool little part of that, but nothing too much to prepare other than to just know that they'll be there and not be too surprised by that.
Thanks, Betty.
Thank
Yeah,
you.
you brought up a great point too, because you actually might be seeing some individuals here right now that are maybe going to be residents in the next cohort. Jaden, any comments to add to that question?
I'd say it wasn't initially intimidating, but I think the part that I liked most was just hearing other people's stories. And you can kind of just piggyback off of their ideas. Like maybe their story can kind of light up an idea that, or kind of light up a situation that you've had that you can also share. So I remember when I was interviewing and this guy went, and it was like the most thought-provoking answer he gave to one of the questions. And I was like, how am I gonna top that? But as he was telling the story, you kind of just piggyback off of it and say, wow, that was a great story. And then you kind of just go back into your story.
Yeah, great. That was also good because yeah, like we talked about, it's kind of like your story is your story. So be proud of that. Dan, anything that Betty or Jaden didn't mention that you wanted to add?
I would just say stay engaged. Like my colleagues have mentioned, just listen to what they have to say. Don't let it minimize your own story. Just be sure to highlight what you want to say as best you can. Everyone has different experiences. Everyone makes an impact on different people's lives. So make sure that you don't try to outdo someone, because you don't want to sound forced, right? Everything you say, you want it to be organic, something that really comes from your experience. So don't try to outdo anybody. Just acknowledge what they say and highlight what qualities you want to highlight when you give your answers.
That's really good, Dan. Thanks again, Riley, for the question. All right, who has another question for our panelists? All right, Sarah.
Hi, everyone. So just to add to Riley's question, can you please help me understand what the format of the interview is? Like, for example, do we raise our hand to speak, or will they say, okay, Sarah, now it's your turn? How does it work?
Okay, before I answer, Dan, you want to answer?
Sure, it's kind of like a round robin format. Basically, each member of the interview panel asks you a question, and each interviewee takes turns answering first. So let's say I answer first, the next round, let's say you answer first, and so on and so on. Yeah, so each person has the opportunity to answer first. That way it kind of keeps everything on a level playing field.
Yep, thanks, Dan. And then the facilitator will actually call upon you. So they'll say, Sarah, this next question is for you. And then they'll share the question. And you will have a hot mic the whole time. So careful that you're not, muttering things under your breath or, whatever else might be happening. So your mic will be on the whole time, so you don't have to worry about like muting, unmuting. They'll just call on you.
Thank you. That's really helpful.
Yes. And then I saw Marlon.
Hi, I have a two-part question. I'm just wondering if you were able to redo this again, if there is something that you would change. And also, what did you include in your introduction?
Great question. Betty, do you want to share?
By redo this, do you mean like redo the interview or?
Yes, like redo your interview.
Well, I guess it went well since we're here. What would I redo? That's actually a really great question. I would probably like calm down a little bit, like not be as anxious and scared and like believe in myself more. And it's like so much easier said than done. But in all honesty, like, your stuff, you went to nursing school, you had clinicals, you had various jobs, whether they're in healthcare or not, like you guys have experience, and like we just hype ourselves up because this is a really great opportunity, and so it means a lot. And so just if I would go back, I would kind of like calm down and not be so anxious going into it, because it's hard to hide the anxiety. And the hiring managers, they know we're anxious, and they know we've been preparing, but you don't want to come off like super jittery, I guess. And then I'm sorry, what was the second question? You had two parts.
What did you include in your introduction?
Oh, that's a great question. Yeah. I would definitely recommend working on your intros, just because that's the one and only question you absolutely know for sure that they're going to ask. But I wouldn't go like too far out into your intro so you don't have any material left to talk in your interview. But I included what school I went to, when I graduated, what kind of honors I had, and what kind of clubs and organizations I was either in or led. And then I speak another language, and I'm very proud of that. So I kind of touched upon that as well, because that's really prevalent in healthcare. And then also I was a nursing assistant at a couple of different hospitals, including Stanford. So I mentioned that I already had some hospital experience in and outside of Stanford. So kind of like a quick general idea of my educational and my work background and my skills of speaking another language.
Thanks, Betty. Jaden, anything you want to add?
Piggybacking off Betty, I don't know how much I would change since I'm sitting here in this interview, which I feel very thankful for. But in terms of your second question about the intro, I think that's, I made it a point to say I went to University of Miami and kind of exposed myself to a very different culture. And something about how that just helped me broaden my horizons, and I can bring that into nursing, from what I remember.
Thanks, Jaden. Okay, Ash, there was a question from Ashlyn. Your hand disappeared. Did you still have a question?
Hi, Christine. It was going to be kind of in line with the previous question. As a new graduate panelist, being respectful of everyone's time, what did they really focus on in their introductions? As far as for opening the interview, you don't want to go on assuming they have all your information. So I guess highlighting those key skills and what you've learned in your education is helpful.
Yes. Okay, awesome. Christine, a question for our panelists?
Actually, this question might just be for you, or like just a general question. I'm not sure if you kind of mentioned it during the slide, but I was wondering if there was any way we can opt in on an in-person interview for the panel, or is it really strictly Zoom?
It's all Zoom.
Okay. All right. Thank you.
Yes. Amos?
Hi, can you hear me?
Yes.
I had a question. In the interest of planning, what is the anticipated length of time, both for the panel interview and the unit level interview, assuming that happens?
The panel interview is about an hour.
Okay.
And then should you be brought back for a unit level, it can range from 30 minutes to upwards of an hour, depending on how the conversation is going and how the interaction is happening.
Thank you.
Hallie, a question for our panelists? Kelly, we can't hear you if you're talking. I saw you come off mute.
Christy, while we're waiting for Kelly, I just had a question that was in the chat, and then just a clarification for the RN license date would be July 28th is the date we have down. Just to clarify that one. And then also Victoria in the chat had a question. I don't know if she wants to come off mute and ask. I thought it was a really good question about if you would get the same questions in the panel and unit specific questions, unit specific, and would it be okay to use the same answers? So if the panel wants to answer those, I thought that would be good for you guys to answer.
Okay, I'll let the panel go. I wasn't sure she was going to come off mute. Dan, do you want to answer that?
Yeah, I think the question was, are the questions the same? And if so, can you reuse your answers? I don't remember the exact questions that I was asked and if they were the same between the first and the unit level interview, but I do remember that the participants were different. I don't see a problem with reusing your answers, especially if you're proud of them. If they highlight all the things you want to highlight, especially your nursing skills, the experiences that you learned, the results that help you become a better nurse. I don't see the problem with reusing those answers.
Thanks, Dan. Hallie, are you able to come off now?
She responded in the
Christy,
chat.
she's in the chat.
Okay.
She says, not sure what's happening with my mic. I was wondering if the application essay questions come into play for the panel interviews and if they are worth looking over again.
Okay, panelists, what do you think? You probably don't even remember do you remember what your questions were in your application?
No, not really,
I
honestly.
definitely don't remember.
I don't know that it was the same though. Like, I think my interview questions were different from the paragraphs that I wrote.
Yeah, the most likely your questions in your interview will be different. The only one that could be potentially similar would be one about a caring moment that you had with a patient. Potentially that would be the only one that you might see that would be in the application, but then you might also see it in the interview itself. So I would say that that would be something to certainly kind of go over, maybe sharpen a little bit. And I would also say that in the other questions, that the last question was kind of like, what drove you to nursing? Like, why did you want to do this? And I think that is also a very driving question. And so I would definitely look back at that and kind of have, know why this was important to you and be able to speak to that. So I think, yes, it is worth looking at them, but you won't see them in that exact manner. Victoria, did you have a question for our panelists? Victoria, are you there?
Can you hear me?
Yes.
Okay, sorry, it's loud in here. I was just wondering what the support system is like throughout the program from the peers and other coworkers, and yeah.
Okay, thanks, Victoria. Den, do you want to take that one?
Stanford was, I don't want to sound corny, but it was actually my dream place to work because I was fortunate enough to be a student at Stanford for about a year. I did my capstone there and I did my master's rotations there. And the environment is extremely supportive, and I'm not exaggerating one bit. In terms of the new grad residency program, all your fellow cohort members are there for you, especially now that it's in-person meetings. It's nice to meet people going through the same experiences as you. And the big four who run the new grad program, they're extremely amazing. They're literally a phone call or an email away. Your unit management is amazing. The unit educators are all there to make sure that you transition into practice as seamlessly as possible. I don't know how many of you went to school during the pandemic or had your hours affected by the pandemic, but the amount of support that you get during the new grad program is really confidence inducing. It made me feel a lot better about going into the clinical environment.
Thanks, Den. Betty, anything you would want to add?
I totally agree. And just to kind of add on to that, because Stanford is a teaching hospital and the new grad program has been around for so long, everybody knows you're a new grad. Like, you tell everybody and they know what that means, and everybody is extremely supportive. And I think I was really scared to talk to managers or senior nurses because I essentially knew nothing day one. And they, I introduced myself, I'm a new grad, I have so many questions, I don't even know what I want to ask. And they totally got it and are always available to answer questions, to talk to you, whether it's managers or senior nurses or anybody. It's a really environment to be a new grad, in my opinion. So I'm very thankful for that.
Thanks, Betty. Jaden, did anyone say anything that you didn't already think of?
No, pretty much hit the nail on the head. It's really good. Not gonna lie, I didn't know how to spike a bag when I first started Stanford. Just that's how cut my hours were during the pandemic. And just the amount of support I got from not even just my preceptors and unit educators, just literally my coworkers alone. I would just be walking around the unit scrambling, and then just a random coworker would ask me if I need help with anything. And it just felt, I just felt very secure and very supported throughout the entire program.
Thanks, Jaden. All right, Riley, question?
Hey, so sorry to be asking too, but I didn't see anyone else have questions. So it's my understanding from both this presentation and others that I've watched that there are only behavioral style interview questions. But I was curious, are there ever clinical-based interview style questions, either during the panel or during the unit interview?
Panelists, did you get any other types of questions? Probably not during the panel, but maybe in the unit level. You see Betty nodding her head.
Yeah, I had one during the, oh, sorry, go ahead.
I'll be quick. I have the first panel interview, obviously, is behavioral questions. And then for the unit interview, it was more so trying to get to know me. And that was just my experience. But talking to other people, I remember they said the unit interview did have some clinical questions. And I'm not sure how much I can delve into that, but they did.
Thanks, Jaden.
If I could just follow up on that briefly, if that's okay. What's the best way, in you guys' opinion, to prepare for clinic-based interview questions?
Well, I had one on my unit interview, and I didn't think I was going to have one, and it went fine. So they know you just graduated nursing school. So the question is very level appropriate. They give you time to think about it, and it was also a little bit of a back and forth. I would ask for follow-up questions, they let me write some notes down, so it's very level appropriate. They know where you're at. They're not going to trick you. They just kind of want to see how you critically think. I think that's all I can really say about that, but yeah.
When in doubt, take vitals.
Yes.
Thanks, Jaden. Thanks, Betty. All right, Ashlyn, did you have another question?
I do, thank you. So this is for Den, Betty, and Jaden. I know within the program, you're made to do an evidence-based project. Just wanted to know if going into the interviews, if you had anything you were particularly passionate about or interested in, and how the experience has been for you as a part of the new grad program.
Dan, you want to answer that one?
I'm sorry, Ashlyn, can you say that one more time?
Yeah, of course, sorry. So I know you have to complete an evidence-based project as a part of the new grad program, and I wanted to see if you had any particular interests that you went into the interview with, and have you incorporated that into your project, and how has that process been for you?
Okay, so I went to nursing school with a concentration on public health. So my main interest is diabetes education with minority communities. But in terms of the evidence-based project, it's more geared towards the unit that you're on and how your project could benefit that unit, if that makes sense. For example, ours was something to reduce hospital-induced delirium. So things of that nature. That's what the evidence-based projects were geared towards, not more so our personal interests.
Okay, great. Thank you.
Thanks, Dan. Katrina, you have a question for our panelists?
Hi. So preparing for an interview where obviously you don't really know exactly what questions you're going to be asked is a little bit intimidating. So I was just wondering if any of you had an experience during your interview, if you can remember, where you were asked a question that you didn't feel like fully prepared to answer, and kind of what you did to come up with something on the spot. Because obviously Christy said like you never want to say you didn't have that experience. So
Good question. Dan, Betty, Jaden, did any of you have a question where you it blindsided you a little?
A little bit. I think what really helped though is I tried to make it a big point to have 7 or 8 significant clinical stories that I not only took action in and had results in, but also that I learned from. And whenever you have that many stories in your head, any question that you get asked, you can kind of tailor it to whatever question it is. So I think I can't remember the exact question, but I was kind of blindsided, and I was like, I don't have the exact same experience, but I do have a similar situation, and that's how I went off onto that certain story.
Yeah, good answer.
thank you.
All right, Kendra, any questions or a question for our panelists?
Yeah, hey, I actually was really relieved to hear Jaden talk about how when you first started, you hadn't even spiked a bag yet. Just because everyone's so obviously who is in the program and is interviewing seems to have obviously great qualifications. So it makes it a little less intimidating. But what was your experience like in terms of your learning curve once you were actually in the program? Where you started to feel a little more comfortable working with patients, having more than one, where you kind of started to feel like, oh, okay, I can do this.
Anyone?
They kind of ease you in to the practice side of nursing. They kind of give you the easier assignments, so to speak. That way you kind of get your feet wet in terms of nursing practice. And then I think you have 3 months with your preceptor to get acclimated. And then even before you're on your own, you have kind of I forget what they call it, but it's like a practice shift where you're by yourself and your preceptor is like your float nurse. So that way it's kind of a dry run of you being on your own. But don't panic. They don't throw you in right away. They ease you in gently. And a lot of the classes that you take during the new grad residency really supplement what you're learning on the floor.
Thanks, Dan. Jaden, you were also nodding your head. So you have a similar story?
Yeah, it was definitely, I mean, especially for BMT, like everyone speaks in acronyms, like you try to read the doctor's notes and it's just all consonants and vowels. And but like Dan said, they do ease you in. Like you start off with a shadow session and then you start off with your preceptor kind of holding on to them. And then as you progress through the preceptorship, your preceptor might say, okay, you're in charge of this one patient. And then later on, okay, you're in charge of 2 patients. And then later on, okay, you're in charge of all 3 patients. Just come to me if you need help. So it definitely was easier. Like the learning curve was hard in the beginning, but it gets easier with time.
Thanks, Jaden. Okay, I'm going to take a question really quick from the chat, and then Heather, I'll get to your question next. Okay, so just a moment. So this is from Kelly. She's having some mic issues. So she's wondering from the residents, is it correct that we should stay with clinical examples and avoid work examples such as coaching, baristas, waitress, etc.? What do you recall of that?
I think it depends on the question. Some questions are more universal, like service recovery questions. I think you can pull from previous work experience. Like for myself, I was in investments before I became a nurse, so I pulled like customer service or patient experience type questions from that part of my life into the interview. But if it's questions that are more geared towards patient care, then of course stick to the clinical side.
Good advice. Jaden, Betty, anything to add? No? Okay. I would agree. I would say that you would want to definitely focus on your clinicals because the role that you are applying for is that of a clinical nurse. But if you have just this really amazing, touching story that has to do with something else, another aspect of your life, then probably okay to share, but really should stick to the clinical aspect with your stories. And then maybe at the unit level, when this is more of a more intimate audience, a little more focused, that then you have the opportunity to maybe share those stories at that point. Okay, Heather, question for our panelist.
Hi there. I wanted to ask, is there an opportunity to ask questions in the panel, and do they ask follow-up questions to you once you've responded, or is it like just static and they move on and say thank you and go on to the next candidate?
Sure, I'll take this one, panelists. So in the panel interview, you will not have an opportunity to ask any questions. There will be 5 panelists on each panel, and then we're just interviewing all day, every day for a week. So you will have an opportunity to ask questions should you be asked to a unit level interview. In the event that you did not answer a question thoroughly, there is a possibility that they might ask you to, and you know, what was the outcome or what did you do exactly? They might ask a clarifying question, but chances are that was your opportunity. They will say thank you and then move on to the next panelist. Deja.
Hi, everyone.
Did I say that correctly?
You did, yeah, thank you.
Oh.
So just to piggyback on Ashlyn's question from earlier regarding the evidence-based project, is there a timeline for that project? Like, do we start it towards the middle of the residency, the quarter end of the residency? I'm just curious.
Sure. Betty, you want to take that one?
So it's all very well structured. I personally just started it like 2 months ago, I think. So it's about maybe halfway through the residency program, maybe a little bit more than halfway, but you literally have exactly what you have to do each seminar, and it's all in seminar, like you meet once a month with all the other residents, and so nothing's done outside of seminar unless you're like sick that day and you miss. So it's very well structured. You don't have to like really stress about it. And because you're working on it with the people from your unit, it's very unit focused, unit based. So you totally understand what's going on. It's not going to be like some crazy evidence-based practice about something you don't understand. It's going to be something relevant that you're already doing for the past 6 months, every single day at work, if that kind of makes sense.
Awesome. Thank you so much.
Thanks, Betty. Christine, did you have another question?
Yes, I do. So my question is, I'm not sure if the other 3 have any, I know one of them has a master's degree already, but this is towards us, people who have like ADNs and currently working towards their bachelor's. Will that workload and the workload in the program kind of make it hard for you to go through the bachelor's degree as you're going through it? Sorry, I don't know if that was a clear question or not.
I understood it. I can't recall. Do it, Jen, Betty, Jaden, anybody start with an associate degree? No. So what I can say is that we do have several residents, each cohort, that do start with their associate degree and then are either in school as they are starting the program, in school in the middle of the starting the or midway through, and they balance it. It's a lot of work. I don't want to mix words about it. It's a lot of work, but they are successful I find that the hiring managers are very, very responsive and very supportive. They really do understand, as we do too in the nurse residency program. So while attending seminar is mandatory, we certainly, respect the fact that you have life outside of it. And so for that reason, we don't give you anything to do outside of the work setting. So your time is your time, and that you can focus on other things like potentially working on your bachelor degree. So yes, very hard, but it's been done and it's currently being done by several of our residents.
Okay, thank you so much. That's really reassuring to know. Thank you.
You can do it.
Yeah, we have like two, I think we have two ADNs on our unit. I'm not sure that they went through the residency program, but it's interesting to see them work full time and also work on getting their bachelor's. It's crazy, but they got it done.
Okay, thank you.
Yeah. Okay, any other questions for our panelists? Okay. So I will open it up now. Any other questions? I've been seeing the chat going off. Carrie and Letitia are monitoring that for me. Any other questions you want to just ask before I let everybody go back and have some part of their day? Heather.
Sorry, guys. I just had one more question. Is it possible you can get selected for more than one panel interview? Or not panel interview, but unit interview?
No, it'll just be one unit level interview.
Thank you.
You're welcome. Amos?
Hi there. Again, I've seen this in the chat, but I don't think it got answered yet. And that is, do new grads start at nights or days or evenings, or does that transition after the conclusion of the one-year program, or how does that work?
Good question. And before I give my 2 cents, Den, Betty, Jaden, you guys want to answer? How are you all starting? Nights, weekends, days?
It depends on what your unit needs. For example, my unit hired me specifically for nights. They hired 2 new grads for days, 2 for nights, but they had me train on days and then transition to nights. When I was fully trained, if that makes sense. But it all depends on what your unit needs.
Thanks, Dan. Betty?
I was hired as rotating, so days and nights, primarily nights. But from my understanding, like, you can talk to management if you absolutely cannot do nights, or you really like days, whatever, you can talk about it with them depending on their needs, but a lot of people are hired as rotating.
Jaden, any other comments?
Not much else to add. I started on nights, and I was on nights for a majority of my preceptorship. And once I realized I only had 3 weeks left, I asked them, hey, can I just switch over to days now so I can get some exposure to days with a preceptor, so that it's not going to be such a blindside when I actually start.
Thanks,
and are you on a
Jaden.
rotating basis now?
Correct. Yeah. We're all hired through our union, which is contracted for rotating shifts, unless you decide to apply for a permanent days / or a permanent night position with the hospital.
Thank you so much.
Yeah, so Amos, it really just depends on the unit need. So as the panelists were saying, it could just, some managers are just looking to have night shift. Some are looking for rotating. So you will likely start on one of those 2. If you're a rotator, you might start days and then transition to nights during the orientation piece, so that way you get the feel of both. But it just really depends on what the unit need is. Alyssa?
Hi, I was just wondering, if you're selected for a unit interview, and say that you don't get an offer from that unit, will you still be an eligible candidate for the other unit managers who were there during the panel interview?
Good question. So typically, if you are brought in specific for a, so after you're done with the panel level interview, the hiring managers all get together and they have a big conversation about, which candidates are their, first, second, third, fourth, fifth, sixth choices. And they bring those individuals back for the unit level. So in the event at the unit level, you were not considered just because of the other interviews that were happening. If another department or unit, if their candidates did not interview well, let's just say, then potentially they might say, hey, Alyssa actually was great. We really, really liked her, but you know, Den and Betty and Jaden, they just blew it out of the water. They were so fantastic, but hey, we totally recommend her. Then potentially there is an opportunity there for that reason.
Okay, perfect. Thank you.
You're welcome. Travis, did you have a question?
Hi, yeah, I just wanted to ask the panelists if there's just any advice you'd give to just new grads in general, anything going back now you'd like to just share with all of us. Thanks.
Yeah. Dan, Betty, Jaden, anybody?
You probably heard this during nursing school a lot, but never be afraid to ask. No question is stupid, or no question is not worth anybody's time. If you feel unsure of yourself or unsure of what you're doing, just ask. I'd rather ask and feel slightly embarrassed and jeopardize a patient's well-being or my license, you know what I mean? So that's the number one thing, whether you start at Stanford or some other new grad program. If you have a question, ask.
Thanks, Dan.
I think I'd also say just get to know everyone on your units. Like, you are spending 12 hours out of your day on a very high stress job. And if you have bad rapport with any of your coworkers, it makes the shift way worse. So it's a matter of getting to know them, introducing yourself, saying hi in the morning, saying bye at nights, or vice versa, and just trying to maintain good rapport with the people you work with.
Thanks, Jaden. Betty, anything to add?
Yeah, just to be kind to yourself. Like, you're a new grad, you just graduated. You're not expected to know everything and be the best at everything. And that's really hard to like swallow coming from nursing school, where you're like made to be like top of everything. But this is a real job. There are real lives, you know, at stake here. And just to be kind to yourself. If you have a bad day, it's not your fault. Sometimes situations happen, patients are sick. If you are taking longer to do something than you like think you should, like, it's okay, you'll get there. Like, just be kind to yourself, ask questions, be as slow or as fast as you need to be. If you completely do nothing on your days off and you just sleep, I used to feel so guilty for that, but if you need that, then you need that. Just like be kind to yourself. It takes time. It's okay, it's normal.
Thanks. Great words of advice, guys. Kendra, question?
Yeah, thanks. The last question for me. The classroom time that you guys do, does it tend to be, I think it's once a month, even the non-evidence-based practice portion, does it tend to be on like the same day each month, like a Friday or a Wednesday? I'm just thinking because I am also in a RN to BSN program and factoring that into it.
Good question. What do you guys, Betty?
I have absolutely no idea what day of the week it is, if I'm being totally honest. I'm so sorry.
She just shows up.
Yep,
I just
exactly. So to answer your question, honestly, it's hard to answer. So it kind of depends. So sometimes we have everybody grouped in one large group. So we'll have all, 100 residents in one group. And those tend to be towards the end of the week. So like more like a Thursday maybe, or a Wednesday. But then also we recognize the importance of having smaller groups, because then you can have more meaningful conversations and connect a little better, especially when we want to do, like practice exercises and team building. And so on those days, we often are split up into like 3 groups, so 3 days. So a lot of times that looks like Tuesday, Wednesday, Thursday. So there's no really good way to answer your question, except to say Mondays and Fridays, typically, we do not do seminar. So I can say that much at least.
It makes me feel better about my answer, so thank you.
Yeah, that's why you don't know. Okay, Christine.
Okay, also last question for me. So this new grad program at Stanford, is it a contract base, or where we stay there for 1 year and then after the end of the program we leave, or how does that typically work?
No, there's no contract.
Okay,
So
so we can stay after the new grad, and then we can, stay in the unit and the hospital that we want to work, the facility that we want to work at after it.
well, so when you are hired, you're hired to a unit. So that unit is your boss. So if you don't want to work on that unit, then my suggestion would be not to accept that job. You will be trained. The program is 1 year. We ask you to stay for the year, but it's not there's no contract. We want you, you're supposed to stay for the year. And then if you chose to work somewhere else, that would just be like any job where you would have to quit and then go work somewhere else.
Can I, Christine, are you kind of referencing other like extern programs where you do a certain training and then that's the end of the?
Yeah.
Yeah.
Yeah. Okay.
Yeah, no, here you're hired as employees of Stanford. And so say you're hired in a certain unit or division, that's where your home unit would be, and we would welcome you to stay as long
Okay,
as
perfect.
for the entirety of your career, for sure.
Right. Thank you.
Thanks, Letty. Any other questions for our panelists or otherwise? We have just a few more minutes left. Okay, I don't see anything or hear anything. So, oh, Riley, yes.
Hi, I just had a brief question for those of us that would be relocating for this position. Are there any ways that Stanford helps out with finding roommates or finding places near the hospital?
I think they have some resources, right, Carrie? But I don't know that they necessarily help with that necessarily.
Yeah, there's relocation assistance. If you have questions, email the new grad RN email address, because we look at that with our human resource colleagues, and they can answer questions related to that. There is information on the website about that, but if you have specific questions, that's the best place to ask.
Thanks. Okay, if there aren't any more questions, I appreciate everyone's time. I hope you found it helpful. Mitzi, I see you have your hand up.
Yeah, I am so sorry. I was just wondering when would be the best time to take the NCLEX if the deadline is July 28th?
Well, I would check with
Can
the
I answer
BRN.
that, Christy?
Yes, go ahead.
You should take it as soon as you can. You have finished your program and you have learned all the information. Go online right after this webinar, sign up for your test date, and take it. Do not wait. You have learned everything. Go in and do it. I would not wait to the very end. Know that there's a 45-day waiting period to retake the NCLEX. So give yourself that wiggle room if you don't pass to potentially retake it before that 28th of July deadline. But have the confidence to go in. We recommend that you take it sooner rather than later.
Got it. Thank you.
I'll also say that the California Board of Registered Nursing, they're, at least when I was doing it, they're like severely understaffed and they take forever processing your test dates and your, like if you don't have your ATT to do a test, it takes a while.
Thanks, Jaden. Marlon?
My question is kind of following up on that last question. I've already submitted everything. I'm just waiting for my ATI information to come through. If for any reason I'm not able to book an exam date before the deadline, would I just have to withdraw my application and resubmit it for the fall? And would that be counted against me for some reason?
No, not counted against you. But you are correct. We could not move forward because you wouldn't have your license in time.
Thank you.
All right. Last chance. Any other questions? Okay, well, I'd like to thank our panelists, Den, Betty, Jaden. Thank you so much. I appreciate your time and coming on today. I hope everyone found this helpful and informative. And just remember to practice, practice, practice. We wish you the best of luck. and look forward to maybe seeing you in the interview process. All right, take care, everyone.
Thank you.